Nick D'Angelo, patient coordinator at Sponaugle Wellness Institute. And today, Lindsay, is a very, very important day for you. You're in the process of exiting treatment here, and you've been here for some time now. We want to kind of get introduced to you. So if you would, tell us, Lindsay, a little bit about yourself. What kind of led you here to Sponaugle Wellness? What had transpired? How sick had you become? And what your treatment was like here?
Yeah. So I started getting sick in December of 2011, beginning of 2012, and it started with pain, chronic pain, what I thought were UTIs, and that led me to my GP, visiting with her, and going on about 6 months of antibiotics, and lo and behold, they were not culturing the urine to figure out that what exactly was going on in the body.
Sure.
And I finally decided I needed to see a urologist at that point, because I was not getting better and the pain was getting worse. And at that point they decided that I needed to have a cystoscopy done, which is like an outpatient procedure where they look at your urethra, and they diagnosed me with interstitial cystitis, which is an autoimmune disease. And what that is, it's like hemorrhaging of the bladder when your bladder fills up with water or urine. So from that point, I tailored my diet dramatically because I did not want to go on any medication. And I did what I could to alleviate the pain, which helped. I met with a nutritionist, and I thought I was getting better. And then September of 2013, I remember exactly where I was. I was at a restaurant with my husband and my little one, and I had some bizarre head sensations start. And I suddenly got confused about where I was. I felt like I was gonna pass out, and then I felt like I was hallucinating, and then just it happened very quickly.
Sure.
And then from that point on, the neurological aspect of the disease just got worse. And I thought when it first started that it was an inner ear issue because it threw off my balance. I would walk into like door frames and my equilibrium was off.
Sure.
So I went and saw an ENT, and she did some tests to determine that it was not an inner ear issue, and said, I believe this is related to the brain, and we did an MRI, and that's when it came back with the lesions on the brain. And so from that point, she sent me to a neurologist, and I met with a neurologist, and he did a whole slew of tests, because he was under the impression that it was MS.
Sure.
Because of the lesions. And after looking at the MRI of the brain, he wanted to follow up with a spinal tap, and the spinal tap was clear for MS. So he sent me to a naturopath because he said, there's nothing else I can do with you. We've ruled out MS. There's still a possibility it could be Lyme. And by the way, the ENT did do a Lyme test on me, and it was negative.
Okay.
And went to the naturopath, met with him, did, I don't even know, 50 vials of blood with him. Everything came back great. You're not sick, you look great, you have some iron deficiency, and wanted to put me on some iron supplements, also did a Lyme test, that was negative. And at that point, several years into this, the neurological stuff just got worse and worse to the point where when I was dropping my little one off to school, 15 minutes later I couldn't remember if I dropped her off or not.
Sure.
Sorry. So at that point I knew something was very wrong, and we knew a family doctor that my sister had seen and recommended that I go see and he's local to us, and he found the Lyme, not by using the regular Western blot or the ELSA test, but by looking for the biofilm itself.
Right.
And that's how he found it. And from that point on, I met with him in January of 2014. He was treating me, and it was helpful. I did a lot of work with him, and very appreciative of him. I just wanted to step it up
Sure.
a notch.
Sure.
Because it was really, it took everything out of me to get to work, do what I needed to do at work, and get done and get home to my little one and pick her up and do dinner, and I was making it through the day. That was it.
Sure.
And I couldn't live that way anymore. Not only that, I was on probably 70 vitamins a day, and that was my life. Every 2 hours taking supplements, wondering, is this my existence?
Sure.
Am I gonna ever get better? So I started researching more, and I found Dr. Sponaugle, and it was by God's grace that I found him, because it's been such a blessing to be here to me and to finally get answers to everything that's going on in my body, and treating the entire body, not just one piece, because we're not just one piece, and explaining everything to me, and feeling better in a couple of months, as opposed to something taking
Right.
years. I mean, and that's time that you never get back, for yourself or for your family.
Sure.
So
Tell me this about your respective case. Your doctor, who was able to determine that you did have biofilm. It's quite obvious that you had substance in your blood, some alien substance.
right.
Obvious, obvious impressions from the Lyme spirochetes in the blood.
Mm-hmm.
When you arrived here, and we do testing to look at blood smears ourselves,
Right.
what did that look like despite your treatment when you got here?
It had improved since I had met with my Lyme doc at home, but it was not where I wanted it to be.
Sure.
I mean, of course, I wanted it completely gone. You could still see the spirochetes in the biofilm when I got here in September. And the last biofilm that I did was January 7th, and it's almost clear.
Sure.
I mean, there's I can't see any spirochetes in the biofilm whatsoever.
Awesome.
So yeah, it's amazing.
How long have you been treating here?
I started September 14th. Mm-hmm.
So that's going on 5 months almost.
Mm-hmm. Yes.
And you've seen what kind of improvement as far as your symptoms are concerned?
Gosh, my neurological symptoms that I was having are almost gone. I still have, an occasional, head burning a little bit, or it's kind of like the raw nerves, because I did have the lesions on the brain for some time. It affected my myelin sheath, and that's something I'm going to have to continue to work on. But compared to when I started in September, it's night and day.
Sure.
I mean,
One of the scariest things about your case that you just described is that those kinds of cognitive lapses. So you can't remember if you dropped off your little girl or not. How has that changed?
Dramatically. I was so focused on picking her up from school and getting her home and fed to bed, so I could just not be stressed out and let my body relax. And I felt, you have a guilt as a mom. So that was difficult for me, because I couldn't fully enjoy her, because, my body was such a mess and not at peace, that it was hard to enjoy anything else. And, now I can do multitasking. I mean, I couldn't do that before. It was like I could only focus on one thing at a time, or I would forget simple things. My OCD was ridiculous. I would check and recheck and check things just because I wasn't remembering if I was doing something, and that was exhausting. The insomnia was exhausting. You're tired but you can't sleep.
Sure.
Doc always says tired and wired.
Oh, wired,
but
yeah.
that has all improved, and my anxiety is completely gone.
Sure.
So,
Well, tell me this: what are you going back to? I mean, you got a little girl at home.
Mhm.
You're going back to a job.
Mhm.
What's your take on what you're going back to? How optimistic are you for what's coming next?
I'm very optimistic. I'm going to continue the vitamin regimen when I get home. I mean, that's something that, I was doing before I came, and just for a healthy lifestyle anyway, that's something I want to continue. It's the amount of information that I have gained from the Institute here is priceless, because that's something that I can apply to myself as well as my family.
Sure.
And I'm just, you have hope again. You feel like you can move forward and do your job and be a mom and, do the things you want to do without having to worry about your sickness and, oh, I can't do that today, or, So, yeah. It's exciting. It's exciting and nerve-wracking at the same time to leave because, it's coming to an end, but I'm excited to have this new beginning and fresh start.
Awesome.
Yeah.
Well, Lindsay, I can't tell you, how thankful we are to have met you and had you here, and then to just really receive the inspiration that we get from a story like yours. To have you here where you were, obviously
Right.
very, very sick when you got here, and to see you progress like you have, and with with the life to get back to, and
Right.
to assume, and
Right.
the prospect of living well. So thank you for sharing your story.
Yes, of course.
Very, very great to have met you and been a part of this.
And you also.
Thank
Thank
you.
you.